I just came in and she was like this. She was fine yesterday.
Has she been to the hospital recently?
Actually, yes. She went for a scan.
Something very sinister is going on here. Let's take this to the boardroom.
So, we have to investigate Miss Anne Urizen's case.
Let's take this back to the beginning and find out what really happened.
Duty calls.
Thank you, Doctor. That's such a load off my mind.
That's fine.
Bye.
Fine. Come in.
Hi.
Hi, what can I do for you today?
I've got a really bad headache.
Oh, how long's that been for?
Well, around 3 weeks.
3 weeks? Well, we probably will need to send you for a scan.
Okay, so how long is it going to take?
Well, on the NHS, probably about a month. But if we about a month. But if we outsource it to Germany, then we can have it interpreted in about 2 weeks.
So you're sending my scan abroad?
Don't worry, you'll still be in capable hands.
Hi, it's Dr. Patel. Have you had a look at the scan yet?
Yes, I did. There's nothing wrong. She's just making it up. It's just anxiety, I guess.
Oh, so she's one of those hypochondriacs. Okay, cool. Thank you.
I got Miss Anne Urizen's record from the hospital.
Oh, is there anything unusual?
Funny that you ask. Her scan shows a berry aneurysm, but there's nothing about this in the report from the radiologist. Also, her scan was outsourced to Germany.
Oh, so it's been sent abroad for interpretation?
Yeah.
Well, why did they do that? Let's go interrogate her doctor.
Come in.
Hi.
Bye.
We're the Medical Research Investigation, MRI.
Okay, well, take a seat.
Thank you very much.
Were you treating a Miss Anne Urizen?
Yeah, I was. Why did you ask?
Well, she's dead. Why did you outsource to Germany?
Well, it's to do with supply and demand.
The demand for scans has increased due to technological advances in radiology. However, the amount of radiologists has not matched this rise, resulting in a shortage. Due to limited supply of radiologists, supply is therefore inelastic. In this current situation, the NHS will not be able to cope with rises in demand. Outsourcing abroad shifts supply to the right and makes it more elastic. Therefore, the NHS will be able to deal more effectively with demand fluctuations.
Okay, so you've explained the supply and demand, but don't think we're finished yet.
Hi, is this Mr. Smith? What have you done? I've just got a visit from the MRI team and they told me you've got the diagnosis wrong.
What? I didn't have the notes. I didn't know she had a headache. You should have looked over it.
You're going to pay!
So let's get this straight. They've outsourced to meet the increased demand for radiology services in the UK?
Yes. Demand has increased 13-fold over the past 3 years. So in order to meet this demand, they need to outsource in order to increase the output of scans interpreted.
One of the biggest benefits resulting from outsourcing radiological services is the increased output, in this case, the number of scans interpreted, which shifts the production transformation curve to the right. Radiologists abroad can often be paid lower wages due to the decreased cost of living. For example, radiologists in India get paid £20,000 compared to £100,000 in the UK. These savings will allow us to increase usage of inputs in the UK, thus increasing the number of scans interpreted.
Well, that makes sense. Outsourcing increases the efficiency.
Yes, by outsourcing the NHS can make better use of the resources available.
Does that affect its quality?
No. Using radiologists abroad may in fact increase the quality because they're able to super specialise into one particular area of medicine. The Royal College of Radiologists actually insists that outsourced radiologists providing diagnostic services to the UK must comply with the same regulations and evaluation procedures as those working here in the UK.
It is argued that outsourced radiologists have a higher technical efficiency as they are more highly specialised and so are able to interpret scans faster than UK radiologists. Shifting allocation of resources towards outsourcing will increase the allocative efficiency, as outsourced radiologists provide a cheaper service at an equal quality. This will allow the NHS to increase patient utility despite the scarcity of their resources.
So on the whole, outsourcing seems to be beneficial for the country. Are there any negative effects of outsourcing?
Outsourcing does have many benefits, but it also has some negative external impacts. It results in a loss of jobs for radiologists here in the UK and a loss of training opportunities for students who want to become radiologists and technicians. There is also a risk to the security of patients' personal information as it is sent abroad, and informed consent must be given for patient images to be sent outside the EU, which isn't always practical. The main problem is the risk of poorer quality of interpretation and difficulties in deciding who is accountable when things go wrong, just like has happened here.
Okay, so there are a few drawbacks, but on the whole it seems to be something positive.
Let's go find out what other patients from this doctor have experienced from outsourcing.
Outsourcing, it is very good. Outstanding.
It was so quick, that means I can spend more time with Simba.
It was totally awesome. It was brilliant. I love it. It's taking off my workload. It makes life so much easier.
Yes, it was fantastic. Outsourcing's great. I'm loving it.
So what went wrong with Miss Anne Urizen?
It seems to be just a tragic miscommunication. This is one of the issues that needs to be addressed if outsourcing is going to be made more effective in the future.
So who's accountable?
Well, obviously the German doctor.
No, but the UK doctor signed the final report.
You're right. He should have checked the diagnosis before discharging Miss Anne Urizen. Let's go get him. He's going down.
Dr. Patel, you are under arrest for gross negligence. You're coming with me. Get out.
Yes! I didn't get sued!
Once again, the MRI team are victorious in their investigation. It's clear that outsourcing radiology is necessary to meet demand. As our population ages and technology improves, the demand will become ever larger. We have only to thank MRI for putting this case to rest. Let's hope outsourcing mistakes never happen again. Until next time, stay safe.